Welcome back. This is our second panel with the Attorney General, Jeff Sessions, Secretary of Homeland Security, Kirstjen Nielsen, and the Deputy Secretary of State, Mr. Sullivan. The focus of this panel is interdiction and law enforcement, which of course plays a very important role in the overall drug supply and drug demand opioid crisis efforts by the President and this administration. Without further ado, I'd like to recognize Attorney General Sessions to begin. Thank you, sir.
Seated?
Yes, sir. You can stand if you like. It's up to you.
Sometimes I like standing. Technology. The media magic. Thank you all. It's so good to be with you, and we're at a point where we are going to make some progress in America. I am convinced. We know that prices for illegal drugs are down, the availability is up, and the purity is up, and the addiction is up, and the death is up, and the danger of the drugs, particularly the fentanyl and heroin combinations we're seeing, are just extraordinary. I was involved in the early 80s as a United States attorney working on these issues, and we never saw anything like the deaths that we're seeing today. This is totally unprecedented in the history of this country. It cannot continue. It will not continue. The President has made it clear we are going to be resolute. The entire administration is going to respond to his declaration of an emergency, and we're going to make a difference. I just tell you, I believe it. I can sense it already in some of the policies that are ongoing out there. We announced in July the largest medical takedown in the history of our country. We had over 120 professionals, nurses and doctors who had been out of 400, I believe, arrestees that were involved in illegal prescription drugs. And we know that as much as 80% of addictions today start with prescription drugs. That's an extraordinary number, and we'll continue to research it, but that's the numbers that we have, and I have no doubt it's an extraordinary high amount starts as prescription drugs. We also had, a week later, the shutdown of Alpha Bay. This is important. It's a dark web site in which had 220,000 sites where people could order directly through the mail illegal drugs. And of course, fentanyl, for example, is so small, so compact, and such a little bit is so powerful that it's easy to ship these kind of drugs through the mail. The FBI has doubled its resources to identify earlier. We're not going to let those sites get that big again in the future. That's certainly our goal, and we're going to continue to work on that. We've indicted some 3,000 defendants for distributing drugs in 2017, and we created the Opioid Fraud, Abuse, and Detection Network, which is a data analytics system that's well within the existing computer systems of the Drug Enforcement Administration, so we can easily determine what physicians, pharmacies, and other distributors are moving prescription drugs. Some of them are extraordinary outliers. They give us indications of where fraud and abuse is occurring, and we can move quickly on that. That's not been really done before. Target packages are being sent out right now to investigators, and cases are being made. One assistant United States attorney said, I didn't think too much about it, but when I looked at what happened, we knew there were 6 professionals, mostly physicians, in Pittsburgh, and every one of those were on this list. And so it made me a believer, and a lot more were on the list that he didn't know about. We sent out 12 special experienced assistant United States attorneys to hotspots around the country to focus on that. We've indicted 2 Chinese nationals for the first time on fentanyl charges. Most of that is coming from China, as you know, often through Mexico, sometimes directly through the mail to our communities. We established a new program called J-Code. That is the FBI's program with the EA to identify through the dark net and actually purchase undercover drugs in that way and to target those groups. And we announced the Prescription Intervention and Litigation Task Force that will utilize our civil department to file civil lawsuits. We believe we can get an injunction to stop a physician or a pharmacy immediately from prescribing drugs because they have to comply with the law, and we can get a civil injunction and then continue, if need be, a criminal investigation. I'm excited about that, and we've also filed litigation in support. I believe it will be filed today. We've announced our intention to file a statement of interest with the multi-district litigation effort by a lot of the attorneys general around the country on that. Thank you. I think that, okay, good. So I'll just end there to say, this is what we're doing in our department. You see it in the people you saw earlier in the first panel. I believe if we do these things effectively, we can reduce the amount of deaths, addiction, and destruction that these drugs are causing today. It's just unacceptable in this great country, and we'll do our part. And Kellyanne, I know, I have to say, Kellyanne's leadership is going to be so important in this because we do want prevention. We do need to educate people. The president has used the phrase, just don't start. If you don't start, like he never started, and you don't get addicted. So we need to be cautious about, encourage people not to do that. And Kellyanne knows how to communicate well, and it will be a great asset to us. So Kellyanne, thank you.
Thank you very much, Mr. Attorney General. Thank you, Attorney General. I was there on Tuesday when you had the press conference with the state attorneys general and the acting director of the DEA and others, and was really struck by the bipartisan approach that the attorneys general have toward your prescription, that's right, intervention and litigation announcement. Going on to Secretary Kirstjen Nielsen at the Department of Homeland Security, so many aspects of the interdiction of law enforcement front in waging this, the battle against this crisis, Secretary Nielsen, falls under DHS. So we're most curious to hear the progress report and also the vision for the future. Thank you.
Thank you. I did it. I think I was going to have to pass it to you. Well, good afternoon, everyone. I really appreciate the opportunity to join you today. This truly is a shared fight. I'm sure you've heard before and will continue to hear for the rest of today how we must do this in partnership. I'm particularly honored to be joined by leadership from the Department of Homeland Security. We've got ICE and CBP here, Kevin McAleen and Tom Homan. They do this work every day, day in and day out, to protect our borders from all threats and our interior from all threats, but that increasingly, unfortunately, includes opioids. So the president, when he declared an opioid crisis as a public health emergency, he really sent a very strong statement. And the statement to us is America is fighting back. And we will continue to do that with all the tools that we have at our disposal at the Department of Homeland Security in conjunction with our partners, the Department of Justice and the Department of State, amongst many others. Since October, we at DHS have very proactively assessed the current threat, determined where we might have gaps and what else we can throw at it, if you will. So this has allowed us to leverage our investigative and intelligence efforts. You may or may not, DHS may or may not know, DHS is a law enforcement agency. We have 60,000 in CBP alone, but we have multiple agents throughout the department that play a role in this. So we're leveraging our investigative and intelligence efforts. We also do interdiction operations with our international partners, and we've had great success on that front, particularly with our friends and close partners in Mexico. And we continue to look for new partners because, as we know, this dreaded drug, fentanyl, continues, as the Attorney General mentioned, to come in packages of all sorts and sizes and then get in the hands of TCOs that otherwise use it in the drug flow. So we look at this sort of two ways. We look at within our borders, and then we look at stopping across our borders, if you will. So to prevent entry, we do work with DOJ and state and our law enforcement counterparts in Mexico, South and Central America, and China as well, to prevent the flow, but also most importantly to share the information. The sharing of information really has two main purposes. One is to hopefully stop the drugs before they come into our country, but the others is to help us as partners dismantle the TCOs themselves that are the force behind the epidemic. So this information sharing helps us to stop the flow, facilitates the dismantlement, and it also provides clear roles and responsibilities amongst all partners to bring all that we have to bear. So I just wanted to use one example. We have Border Enforcement Security Task Forces, which luckily enough has one of those good acronyms, BESTs. Some of our acronyms at DHS are not so well done. And these are CBP and ICE's primary platform to investigate opioid smuggling domestically. So ICE has BESTs in 58 locations throughout the United States, leverages more than 1,000 federal, state, local law enforcement officials, and it represents over 100 law enforcement agencies. CBP also has officers at hundreds of ports of entry, as you know, and they not only check billions of dollars of cargo each day and millions of passengers a day, but they are particularly focused recently on fentanyl. CBP seizures of fentanyl has significantly increased over the last 3 years. We had about only 2 pounds in 2013. We had 1,485 pounds in 2017. And remember, this drug in extraordinarily small quantities is lethal. So 1,485 pounds is substantial. That is an epidemic. So to confront this explosion, they've expanded the use of canines, and we're happy to report that all CBP canines working in the international mail and express consignment environment now have the ability to detect drugs and fentanyl in particular. While we don't see yet a significant amount of the opioids being trafficked by sea, the U.S. Coast Guard maritime interdictions of other narcotics are increasing, and of course that deprives the funds from the TCOs, who are then able to otherwise use the funds to traffic in the opioids and fentanyl. So to prevent the sale, I'll just talk about that for a minute. We're also committed to not only preventing them at their source, but then of course preventing their movement into and sale within our country. The Attorney General mentioned the dark web. We support his efforts. Our United States Secret Service has extensive cyber capability on the investigation side, and they also contribute to this fight. And so does ICE Homeland Security Investigations. Again, DHS has a broad mission set, but we do in all times work to bring everything we have to bear. The dark net, I would just add one comment to what the Attorney General said. It's anonymous, so it makes it that much more difficult to track who is doing what on the dark net in terms of buying and selling. But with our partners at Justice and FBI and within DHS, we are doing just that. So the job doesn't end there. We also work to support the apprehension and prosecution. Again, we work closely with our law enforcement brethren. What I would say in closing is the sheer magnitude of this means that we have to partner. As I've said many times today, actually in other forum, there's not one entity that has all of the authorities, capabilities, and capacities to fight this alone. So we greatly appreciate everyone in this room, your interest, your support, your partnership. We can't do it without you. We thank the President and the Vice President for their continued leadership, and certainly Kellyanne for all the yeoman work that you've been doing to bring us all together.
Thank you very much, Secretary Nielsen. Thank you. It's been really terrific to have the State Department involved in this effort as well, and today I'm very happy to present to you for his remarks the Deputy Secretary of State, Mr. Sullivan.
Thank you, Kellyanne. It's an honor to be here. Delighted to see everyone here. Thank you for your leadership. And to General Sessions and Secretary Nielsen. You might wonder why the State Department is here. Well, this is a whole-of-government effort. The President has made this a top priority for his administration. The State Department's involved because the problem we confront is not merely a domestic problem. The opioids that are killing American citizens today are produced overseas, and are trafficked by criminals and criminal organizations that operate transnationally. The State Department's role is to stop transnational criminal organizations, so-called TCOs, and the networks of criminal activity they perpetuate in trafficking drugs and destroying the lives of our loved ones. Addressing the opioid crisis, as I say, is a whole-of-government effort, and the State Department's role is to apply its resources abroad with our partners, allies, and others to support all the work that the Department of Justice, the Department of Homeland Security, and the other cabinet departments are doing to address this problem and this enormous scourge that we have, and to enlist the support of our allies and partners and neighbors in Mexico in particular. It's our highest, at the State Department, this is our highest drug control priority. The bulk of the State Department's counter-narcotics work is focused on countries where opioids originate. Opium harvested in Mexico is the root of over 90% of the U.S. supply of heroin. The TCOs that smuggle it across our border to be sold by dealers throughout the country are the targets that DHS and the Department of Justice are working to stop. We're strengthening cooperation with Mexico through the Merida Initiative to interdict illegal transports, find and punish criminals involved in these organizations, and cut off their sources of funding. In December of last year, Secretary Tillerson and I, along with General Sessions and Secretary Nielsen, continued the strategic dialogue we have with Mexico on disrupting transnational criminal organizations. We're working with our Mexican counterparts to find new ways to disrupt the revenue streams of TCOs that are responsible for trafficking heroin and other illicit drugs into the United States. We're also working with Mexico to more aggressively eradicate poppy crops, train law enforcement, enhance border security, and bring drug traffickers to justice. Over 100 of Mexico's most wanted high-value targets, like Chapo Guzman, have been arrested, killed, or extradited to the United States. And we support Mexico's efforts to find, investigate, and destroy clandestine drug labs. Since 2014, the Department of State has funded DEA training of over 300 Mexican counterparts in special tactics to go after those labs. Since 2008, the United States has donated and supported training of more than 500 canines who are assigned to Mexican and federal and state law enforcement agencies. We sponsored training for canines and handling teams to detect weapons, cash, and drugs. This includes, for the very first time, fentanyl-specific detection training through cooperation with our neighbor to the north, Canada. Last fall, the UN Commission on Narcotic Drugs put new international controls on the two primary ingredients that are used to produce fentanyl. This action was taken at the request of the United States, and such measures are already producing results. Due to this change and other efforts, DEA has seen a decline in the presence of these chemicals in the illicit drug market. And in 2 weeks, again at our request, the UN Commission will address controls on 5 other synthetic opioids, including the deadly opioid carfentanil. The State Department is also building partnerships to more effectively stop the traffic of synthetic drugs sent through international mail and courier systems, which General Sessions mentioned. These efforts allow for law enforcement to more easily interdict any packages that may contain illicit fentanyl. China is a growing area of focus on the fight against opioids. Energized by President Trump's visit to China last November, the United States and China have forged a productive counter-narcotics relationship. As a result of our cooperation, China has established domestic restrictions on the production and sale of 143 substances, including a number of fentanyl-related compounds. China's tightening of regulations has significantly contributed to the reduction of these substances on the streets of the United States. Unfortunately, we're beginning to see a new trend of rogue Chinese chemists who are manufacturing illicit opioids, selling them online to drug traffickers and users, and shipping them in small quantities through the mail. As Secretary Nielsen mentioned, the amount of fentanyl that's necessary to convey a lethal dose is extremely small. So we're talking about small quantities of these illicit substances. In response, we're working closely with China to improve coordination and screening of mail packages between our two countries. We're on an aggressive timetable to get all packages coming from China tagged with advanced electronic data. And we're going to continue that close cooperation with China and other countries that are sources of these chemicals and illicit opioids. Collaboration is the only way we can tackle a problem that has no regard for international borders. The State Department will continue to aggressively pursue this fight against opioids in partnerships with all other nations. Thank you.
Thank you so much, Deputy Secretary Sullivan. That's a lot of information. I think it strikes America as brand new information in many ways, so we very much appreciate all the efforts of the State Department by Secretary Tillerson, you and your vast team. So we're going to open it up for questions. First will be from New York City, Dr. Jeanette Neshwa. Hi.
Good afternoon, everyone. It's great to be here today to discuss such a critical issue of facing our country. Again, my name is Jeanette Neshwa, and I'm a family and emergency medicine doctor. And I've witnessed firsthand with my patients how devastating and how horrific it is, not just for a drug, for the user, but for their families as well. It can really have a detrimental impact on families and tear families apart. And I will never forget resuscitating a young teenage boy who was found unconscious by his friends. And the worst part, one of the worst parts about that experience is having to tell his family, having to tell his mom. It was heart-wrenching. And I hope and I pray that I will never have to do that again. And so I thank you, Kellyanne, all of you, and our President Trump for elevating this issue, this critical issue. It's a real issue affecting families and many Americans here in this country. And, you know, what I would like to know is what message, what advice does our President have for healthcare providers who are on the front line facing this crisis?
Any of you are welcome to answer that. I know there's a real nexus between law enforcement now and healthcare providers. We hear that from law enforcement. In some jurisdictions, a fire station is 3 to 4 times more likely to respond to an overdose than a fire. So we know there's a nexus, if you'd like to respond.
Yes, there's no doubt about it. One of the ways for many decades we've analyzed how serious the drug problem is emergency room admissions. And I don't think we've ever seen anything like the admissions we're seeing now, and so many of those turn out to be fatal. So I do think that connection is important. I would say to you that most of us know somebody who's also suffered in that way, has been hospitalized or homeless even, and lost their jobs, lost their families. And the grassroots communication of the danger of these drugs is the long-term solution, the best solution we can have. I really do believe that. I think it worked previously against the cocaine epidemic, and I believe it will work now and be the most successful thing. And when you can speak out like you're talking about to your community about the disaster of young lives being lost, that would be important. We were in New Hampshire not too many months ago with the governor, 9,000 high school students. 50 mothers stood before them holding large photographs of their children who had died of a drug overdose. It was a powerful thing to see, and I hope we'll all be touched by it.
Just to add, you know, we always ask for your partnership because it's through the information you provide that we can really get after the supply chain. So we need to at all times understand where it's going, where it's come from, and who it's affecting. That helps us really target, if you will, our enforcement activities. So we thank you for everything you do.
I will say that Secretary Tillerson once shared with me and a few others that he believes patients should be told more that they don't need to take all the pain medication, that part of the prescribing is pain management need not mean pain medication. I know you heard that from Secretaries Azar and Carson and especially Secretary Shulkin earlier, but it just tells you how much everyone is thinking of how intertwined the issue is for many. So we appreciate very much that question. Our next question comes from Princeton, West Virginia, and Greg Puckett. You're here, Greg. Last week, the USDA issued some guidance on opioids in rural America, and I think your question has something to do with that as well.
It certainly does. Thank you so much. I want to thank the administration, the panel, Kellyanne, and everybody else for allowing us to come and be with you today. So I do have a couple of prepared remarks to preclude my question. My name is Greg Puckett. I am a commissioner in Mercer County, West Virginia. I've been a commissioner for 3 years, but I've been active in primary prevention strategies and through local community-based coalitions for the last 17 years. So I know prevention actually works on the front end. I would also like to say that I want to give you a quick snapshot of what it's like to live in rural America. When we started this back in 1998 with OxyContin, when it first came down, it was designated hillbilly heroin for Appalachia. We saw it, excuse me, we saw this coming, but it also has harm that is not only to the individual, but to society as a whole. In the last 19 years, the social service system that we have seen has become overloaded. Employment rates have risen to record levels, and I can tell you that from 2005 to 2012, the amount of opioids that came to my community was over 16 million in a county of 61,000. West Virginia has declared a state of emergency for hepatitis C, and 7 counties, including mine, are at risk of an HIV outbreak the likes we've never seen. That's 220 counties out of 3,060 in the United States. According to the CDC, 78 people die of overdoses every day. And in West Virginia, we have that 1 out of every 10 minutes. I'm sorry, 10 hours. 10 hours. If you're looking at from an incarceration perspective, in Mercer County, our jail bill is $1.7 million. That's 20% of our annual budget. We spend more in 1 month of our jail bill than we spend on economic development and our health department combined for 1 month. We need funds in rural communities that look at primary prevention and treatment strategies that have a true impact and not necessarily focus on higher population levels as around the United States, which does lead to my question. With the ongoing exponential problems associated with opioids in predominantly rural America, where geographic terrain and economic disadvantaged areas are, like Appalachia, is the administration willing to send additional resources to fix these areas first, where they are the greatest?
Well, we are, and I appreciate your comments because it's extraordinary how much impacted our rural areas are. And you see it maybe no place in America worse than West Virginia. We have the DEA is reorganized. It's Rob Patterson here on the front row, DEA acting administrator. And they've reorganized so that they've got a new section, a team that will be focused on Kentucky, Tennessee, and West Virginia, where we've got some of the highest problems there ever. DEA also has 6 special teams they've deployed, and I believe 4 of those 6 will go to rural areas. We have designated in every United States Attorney's Office a specialist on opioid cases, and they're supposed to coordinate our efforts, and I know they'll be identifying the rural areas are some of the worst hot spots. So it's remarkable to me how this addiction, these opioids have impacted our rural areas, and some of the information and data that you just shared from West Virginia is shocking indeed. The new data analytics situation and numbers, I think, would have identified some of the problems you've had in West Virginia many years before it ever reached the epidemic level that it did.
Just to add, we recognize that this doesn't know any specific geographic boundaries. So at the Department of Homeland Security, we utilize our National Targeting Center to really try to find out where the risk is and then put the resources there. It also brings us back to the mail. The mail makes all areas equal, right? Unfortunately, we all receive mail. So working with the United States Post Office, working with DEA, with DOJ, CBP is really working to get after that part of the flow.
Thank you. Kevin Mira from Hamilton, New Jersey, where we're talking about maps and identifying spikes in need. Sir.
Thank you very much. Happy St. Patrick's Month to everybody here today. And I want to thank the President, First Lady, and everyone over at ONDCP who's never said no to the parents. My name is Kevin Mira, and my wife Marianne and I volunteer for a small mom and pop nonprofit in New Jersey. All volunteers, and we don't have any federal grants or state grants. So my question is, one second, I forgot. Kellyanne, my wife said that the only way I could retire is if I work with you on the opioid epidemic. So since you're both Jersey girls, I figured maybe you could work it out with her. But
Got it.
Thank you very much. So I'm not a professional. I'm just a dad who buried his son. Casey was 24 when we lost him. I can't believe, it's just hard to fathom that my journey has taken us from his bedroom, where we lost him, to the East Room of the White House. But actually, with all due respect, I'd trade it, all of this, just for 5 more minutes with him, just 5. So City of Angels, although it's a small mom and pop nonprofit, we think we do some big things on the leading edge of the curve. And what I mean by that is we started sending volunteers in the hospitals and into the emergency rooms and into the police departments back in 2008. Now they call them recovery coaches and hope and angel programs, so on, so to speak. But my question centers around ODMAP, another leading edge thing. And we found this down at the Baltimore, D.C. HIDA. It's actually an app for your phone where the first responders, police officers, and emergency medical technicians responding to an overdose can actually sign on and send information, and the overdoses would be tracked real time, which would also go to help identify spikes. And so we're hoping that if there's a possibility that this could be done as a national model and introduced as such. And I'm just going to close by saying I look at your chair, your empty chair there, Kelly, 5,394. 5,394 from today, March 1st to April 1st, Easter Sunday. That's how many chairs will be empty at Easter tables, because we're losing 174 people to overdoses every day. And I'll just close by saying thank you very much, secretaries. You want to know me for what I've learned over the last 10 years. You don't want to be me for what Eric and these other parents have gone through. Thank you.
Thank you so much. Thank you so much, Kevin, for sharing your story and making a difference for others. Also, we will keep you in our prayers. I know, Mr. Attorney General, you talked about data sharing and analytics, and of course, Mr. Mira is talking about the use and the ability to have better data sharing by tracking overdoses and identifying spikes. Anything in the data analytics that you want to talk about?
Yes, the HIDA program, I think, started in early 2017, last year. A lot of places are looking at that around the country. I know a number, I think 3 or more counties were in their initial project. It's proving apparently successful in being adopted. I would just say every area of the country, when you deal with this, we all know there's not one single thing that's going to fix it, but a series of actions, even if it reduces the problem 1, 2, 3, 5%, helps us to be more effective, will add up over time to begin to reverse this trend. And we also know, and was told at New Hampshire when I was there for the first time, but I've heard it repeatedly, that you would think when a powerful fentanyl supply starts killing people, that people would flee from it. But the DEA tells us that some people come, particularly the addicts, and they want more of the more powerful drug. So this kind of early identification can help deal with a spike in extremely dangerous levels of fentanyl.
Thank you very much. Another father who's been able to take that resolve and that action forward, and we saw him on tape earlier, is my old friend Eric Bowling, along with his wife Adrian, has a story to tell about their son Eric Chase. But Eric, I think today you have a question for this particular panel about interdiction that you'd like to pose.
First of all, I would like to say thank you to President Trump, the First Lady, Kellyanne Conway, all the secretaries, the deputy secretary, and the generals, General Sessions and General Adams. Thank you guys so much. Law enforcement, we needed to thank them a little bit more. They're on the front line. They've been amazing, and that's a tough job. I got to tell you, some of the things that they see, you wouldn't wish on anyone. And finally, thank the parents who came here. This is, we didn't sign up for this. I certainly didn't sign up for it. None of us signed up for this, and it's been very, very difficult. A quick story. My question was on the fentanyl, the illegal Chinese fentanyl, and I think you guys have hit it, and it sounds like you're on top of it, and I think it was very important. My son died of an accidental overdose when he bought a pill on campus. He was a college sophomore. He bought a Xanax. He thought it was a Xanax, and it happened to be not a prescriptive Xanax, but one that was purchased from someone on campus, and the Xanax was laced with fentanyl, and he died in his sleep that night. What I'd like to just mention here, he passed on September 8th of this past year. September 9th, we flew out to Colorado, and we're sitting with our doctor. We're about to go over to the coroner, and it's just something no parent should ever want to do. My phone rang, and it was President Trump. And he said, Eric, I don't know how you're doing it. I just want you to know you're in my thoughts and in my prayers, okay? A few weeks later was Thanksgiving, first holiday after his passing, and we are talking. We're about to sit down, a small group of people, 6 or so of our family members, and there's that empty chair. And I know it's about to happen. We're going to sit down. We're going to see the chair. We're going to fall apart. As literally the turkey is on the table, we're walking over to the table. The phone rings again, and it's President Trump saying, Eric, this is very difficult. It's your first holiday without your son. I don't know how you're doing it. If you need anything, let me know. And I said, Kellyanne, I said, Mr. President, thank you. You're going to help this whole family, but can I talk to you about this crisis that's killing so many of our young people? He said, absolutely. And that's how I started talking to him and Kellyanne and others in the administration about the opioid crisis. I got involved, but I'm getting involved as a father. I'm not getting involved as, I have no issue, I have no website, I have nothing other than I don't want anyone else to feel the depths of despair that you feel when you lose a child. I'm representing you guys, the families who are here who've lost loved ones. That's all it's about. It's you, it's not me. General Sessions, thank you for being strong on enforcement. We appreciate that. Secretary Nielsen, thank you. I hope we get that southern border the wall up so that we can stop some of this stuff that's coming through the southern and northern borders. And also, Mr. Sullivan, thank you very much for what you're doing. I think China is, you just need to lean on them as hard as you possibly can. My question was answered, but thank you guys all so much.
I just want to, first of all, please accept my condolences for everyone in this room who has lost someone. We all need to work together to prevent other families from feeling that pain, but that doesn't in any way, I know, limit the pain that you feel. So thank you for sharing with us, each and every one of you. I did want to pick up on just one thing you said, which is when it comes to border security, it's not, and it should not be, as I said earlier today, a political football. It's real. The threat is real. The drugs coming across our border are real. the traffickers and the TCOs coming across and utilizing loopholes in our border are real. So I hope that we can also all work together on bipartisan legislation that will give the men and women of DHS the tools they need to secure our borders. That will help not only with this threat, but many others. But truly, we owe it to each other to give it a good shot at trying to stop the drugs from getting into our country. So thank you for raising that.
Yeah, and I'd just add on China, we work very closely with the Chinese government. They have listed, proscribed, as I mentioned in my remarks, 143 chemicals which are now banned under Chinese law, so their law enforcement now can go to work. We're working to identify other chemicals and analogs of the opiates that also need to be addressed. But there are three aspects of it. One is identifying the substances that need to be controlled and declare illegal. Then, once that happens, working with law enforcement in other countries, in Mexico, for example, so that their law enforcement, with support from us, the Department of State and the Department of Justice, can go after the drug labs, go after the transnational criminal organizations. And then finally, one thing that may be overlooked, and I mentioned it on my remarks, and I think both General Sessions and Secretary Nielsen mentioned it, is the use of the mail. We've really got to focus on that, because the amount of substance that is dangerous that can be sent by mail is really very small. We've got to work on tracking, detection, and so forth, working with international postal authorities, the Universal Postal Union. So a lot of areas for us to work on at the State Department, and it's a priority for us, as Kellyanne said, for Secretary Tillerson and of course for the President. So thank you.
Thank you very much, Mr. Deputy Secretary. All the way from Anchorage, Alaska, Jay Butler. Yes, sir. Good afternoon.
Thank you. I have the privilege of being the Chief Medical Officer for the great state of Alaska, so I'm here to tell you that no part of our country is too remote. No part of our country is immune from the threat of this epidemic. I also have the privilege of being the incident commander for Governor Walker's Unified Command Response, where we've brought together 9 departments of state government to work together in this response. And I want to thank the President and thank all of you for being together today. I see at least 6 departments of the federal government together here today, maybe more. I also want to thank you for the support that we receive from the federal government, particularly in terms of funding. Because working together and with adequate funding, we can make a difference. And the good news is we're already seeing some progress. In Alaska, we are seeing declines in overdose deaths related to prescription opioids. The bad news is that progress is literally being obliterated by the influx of fentanyl, with huge increases in the number of deaths related to fentanyl, even in some of our most remote villages. So fentanyl is powerful, it's cheap, as the General was saying earlier, and it's easily transported. We feel like much of the transport within the 50 states, and certainly within our state, is related to transport on commercial air carriers. So my question is, how can we improve screening for illicit drugs, fentanyl, and I also should mention methamphetamine, which we're seeing more of also, on commercial air carriers, particularly in checked baggage, carry-on, and in shipped packages. And even more particularly, how can we help assure that law enforcement and drug dogs have access into areas controlled by the commercial carriers? Thank you.
Thank you, and thank you for that question. You know, today we are celebrating 15 years of the creation of the Department of Homeland Security, which is both a happy day and a sad day. Sad because we have to have a Department of Homeland Security. But we talked a lot this morning about our expanding mission space, and certainly part of it is with respect to drugs. So as you know, traditionally in aviation, we think of bombs, we think of unruly, criminal-minded passengers, but drugs more and more are top of mind. So TSA plays a role domestically with checked baggage, but CBP is actually our premier component within DHS that looks at the foreign travel of passengers, identifying not only high-risk passengers, officers, but those parcels and checked baggage that might contain drugs. Dogs, as you mentioned, are a very important asset. We love our dogs. They do incredible work. They put themselves in danger each day. As we know, unprotected, if a dog sniffs a very small amount of fentanyl, it will die. So we use the dogs, we use them with caution, we protect our officers. But the targeting becomes very important, and that's where I echo the Attorney General and Secretary Sullivan's comments, because it's only through that information sharing that we can really target. Otherwise, we couldn't possibly go through everyone's piece of luggage, for example. So we do it in a risk-based way. The last thing I would just mention is technology. We continue to look at technology both at our ports of entry as well as our airports to ensure that we can get down to a level where we can identify and interdict even small amounts of drugs. So thank you for that. That's definitely something we need to continue to work on.
Thank you very much, Mr. Butler. Thanks for being here from Alaska. Attorney General Sessions, we heard a comment earlier from Princeton, West Virginia that you touched upon, but I'm wondering if you wouldn't mind telling us a little bit about anything the Department of Justice may be able to do to crack down on the pill mills and the fraudulent prescriptions, knowing that there are tens of millions of Americans who suffer from chronic pain and need those medications. We're talking about the pill mills and the fraudulent prescriptions, like the amount of pills we heard from West Virginia.
Yes, it definitely has to be looked at. We are, as a nation, an outlier. We consume extraordinarily more pain medications by prescription than any other country in the world by far. That is resulting in addiction. A substantial percentage of addicts started with pain pills. And Drug Enforcement Administration, I'm sending him a directive or request today to look at their regulatory capabilities that we can perhaps reduce the number of drugs being prescribed in America. It is my goal, two goals about prescription drugs in particular. We want the death rate down, and we'd like to see the amount of drugs prescribed down. If we are an outlier and we way above the right limit, and we have Medicare, Medicaid, VA, and private insurance paying for these drugs to make people sick, it makes no sense whatsoever, actually killing people. So we've got to tighten that up. I think we are above the right level now, and we're taking a number of steps. DEA can pull a license for somebody they identify as a improper prescriber or a drugstore that's improperly selling, even before a criminal case is made. So we think we need to get better about shutting them down, and we can't wait a year for a criminal case to be made and they continue to prescribe drugs. We can do that through civil lawsuits, and we also, as I indicated, looking to civilly join with our states in some of the litigation that they're filing, and we're looking to see if there's additional civil litigation that the Department of Justice can take independently of the state lawsuits.
Thank you very much, Mr. Attorney General. Deputy Secretary of State, Mr. Sullivan, Secretary of Homeland Security, Ms. Nielsen, and our Attorney General, Jeff Sessions, please join me in thanking them for this panel. Thank you.